busy, but we want to make sure we're getting some tools
Absolutely.
to
Absolutely.
everyone. So I'm gonna let Kelly talk a little bit about all the things that maybe helps us, what he does, and whatever you want to talk about.
All right. Well, thank you, Dr. Terry.
Thank you for being
and
here, Kelly.
Thank you for being here, having me here. Yeah, like Dr. Terry mentioned, this is the season where we start to change. The temperature changes, the sunlight changes. So we'll get into some of those things. Let me just first kind of talk a little bit about myself here. I want to thank you for this collaboration and allowing me to come in and be a part of such a wonderful establishment here.
We are excited that you're here. We are ecstatic.
I am ecstatic as well, excited, and it fits the brand. I think you do a lot of work with the body and the mind and health, and to be able to come in and be able to support people in a time of need, to help them through difficult times. It's certainly a mind, body, and soul experience that we tend to want to treat. And so that's what I'm here to do.
And I think people, because before, especially in certain ethnic communities, going to talk about your feelings, and it was almost taboo.
Yeah.
I think since COVID, it has become people are much more open.
Yeah.
Because women and men, most men have been taught from a young age, just, suck it up, hold it. Right. We are seeing such a much higher rate for males in committing suicide.
Yeah.
And so you guys got to talk about your stuff too.
Absolutely, absolutely, and I offer that space for men. That is an affinity of mine. It's something that I really enjoy working with men, fathers, husbands, young adolescent boys trying to become men. So I do offer some support and assistance with men, and I would love to at some point start a men's group. So that will be forthcoming.
We're actually trying to maybe sometime in the next couple months do a men seminar that includes the mental part of it. We'll talk about testosterone. We'll talk about weight. We'll talk about things that they don't like to talk about.
Yeah.
But need to talk about.
Absolutely.
And it'll be a safe space. I will even excuse myself and I won't participate if that's what it
your
takes.
expertise is needed, but
yes.
certainly. Yeah. And as you mentioned, Dr. Terry, COVID did change a lot of perspective about mental health. It really kind of forced people into some spaces where they were uncomfortable. We were all locked down. Families kind of struggled. We're social creatures by nature. And to have to just be at home and isolated, it was really difficult for a lot of people. And, it caused stress in marriages because, sometimes you need that 8 hours.
Like you here still?
And being real, that, it really caused a lot of stress in the family. And it was really a time where I saw a lot of outreach. And as you also alluded to, in the African American community, we weren't very susceptible or open to, counseling and therapy and opening up your emotions and expressing yourself. So I'm seeing that a lot more these days. We are embracing the need. I always say to men, when our cars go down, we're quick to take it to the mechanic. But when we're not emotionally right, who do we see? So it's really important to take that next step.
And and my big thing is that the reason we even opened up the wellness centers, because just as physicians, we were piecemealing. We were treating this part and then go somewhere else and get that part treated and go somewhere else and get that mental. So it was something that we wanted to have everything that could help that one person with everything in one location. And so it has been a blessing to have someone with such excellent credentials and caliber and who is truly good with people. And so, and I think that he's very relatable, um, and leaves you open to, so that you don't feel vulnerable. But if you don't take care of your mental, the physical is going to start to actually come into play. So we're just trying to, we're gonna give the people some tools.
Yeah, yeah, absolutely.
See how to kind of, get through some of this, holiday season, and I'll let you.
Yeah, yeah. The holiday season is a difficult time. People tend to, with, like I mentioned, time change. It's getting darker. It's dark at 4 o'clock. That's actually called a seasonal affect disorder, which it's a seasonal kind of depression that might set upon an individual where they're not enjoying, life as they once did. The sadness is there. Not enjoying pleasurable things. They're socially isolating. And so, this time of the year is really important to stay busy, self-care. Make sure that you are aware of these signs within yourself. And actually have a plan to engage, to make sure that we are engaging with, our loved ones and not, going into hibernation, if you will. It is a mental health concern that is something we look for in this time of the year. And so, we want to make sure that people are sleeping well, eating well, exercising, and staying engaged. And so those are just some of the quick kind of tips I can.
One of the things that I also tell people to do is, because I'm like that sometimes. When it's sunny outside, I'll clean the house, I'll do everything.
Yeah.
But when it's dark, it's like, I need to go to bed.
Yeah.
But I have actually had people get sun lamps. And you can actually purchase those.
You can.
And so if you are that person that needs to have some type of light, the sun lamps actually do help a little bit.
Yeah.
And then I'll tell them to also take vitamin D. Now that's
Yeah.
just on the medical
That's
side
right.
of it.
That's
Is
right.
that will also kind of help.
Yeah, because the sun creates
Yeah.
vitamin D,
Yeah.
and when we don't have as much, there's a deficiency, and that does affect the mood, for sure.
I mean, we want to, and maybe we'll come up with something where, people can come out and just kind of hang out with us.
Yeah.
And just to get you out of the house if you, and so we're coming up with things just to kind of keep people engaged.
Yeah.
If you just feel like, I don't really have anybody to be around, or,
Yeah.
all of the family, nobody lives here. And so,
Yeah.
so we're trying to come up with different things and different places that people can go.
Yeah.
Now, we do have a facility for working out. Now, you can come here and work out.
That's right, exercise is important, absolutely.
Because it actually increases endorphins.
Yes.
Which are natural chemicals that actually make you feel better.
Yeah.
So all those things and engaging, but we'll let you guys, if you guys have certain questions for Kelly, we'll let you ask him whatever questions you want.
There was a question that came in earlier, and I'm just going to put it up on the screen. What's the difference between a psychologist and a psychiatrist?
That's a good question. So a psychiatrist is actually an MD, a medical doctor, an MD who can prescribe medicine. A psychologist is a PhD level professional who they tend to do testing, personality testing. They do therapy and treatment as well, but they can also teach. And so I am a master level therapist, licensed within the state of Illinois. I'm a licensed clinical professional counselor, and so I am of the master level. And you do have to hold a master's in order to be licensed in the state of Illinois to provide therapy.
And I have written medications for clients and patients who require medication, depending on what the situation is.
Yeah.
So certain things I will do it for depression, I will do it for anxiety, I will do it for certain conditions.
Yeah.
Where I will actually write prescriptions if they require that.
Yeah, and so that's something we look for. We cannot write prescriptions as licensed clinicians, but we certainly look for the more chronic, serious situations that, warrants some more immediate support, right? Because talk therapy, if you think about it, takes a little bit of time. We have to build rapport and, learn different ways of thinking. But medication certainly is something that can help to bring about, a faster relief for people who are suffering from any kind of depression. So antidepressants are really important part of therapy. I tend to think both are hand in hand, that we do talk therapy and medication in times where you might be having thoughts of harming yourself, unable to function in your day, not being able to get out the bed, those kind of more severe cases, we certainly want to make sure that you're seen by your doctor. And quite frankly, a lot of people tend to go to their medical doctors first when they're not feeling well. And it's the medical doctor that would prescribe, but we don't see our doctors on a weekly basis. We don't see, so doctors, they take care of you, they prescribe, they nurse you, they get you back, but therapists, nurses, we're there in more of a collaborative support with you along the way. Doctors are very busy.
So I will say, one of the things that when I do prescribe, I do recommend for people to see a psychologist along with the medication, because I don't think just the medication by itself is enough, because it doesn't help you work through your problem. It helps you with how you're feeling at the time, but we're trying to give you long-term tools, and that's what I think. When you're seeing them on a regular basis, you're giving them those tools to deal with everyday life.
Yes.
So yes, there are some people who are just on the medication. Okay, but I do think you need the tools in order to deal with, because we're gonna go through stress throughout. If you're living, you're gonna go through ups and downs, and it's just being able to have the tools in order to deal with those valleys and so.
I mean, when you think about those tools that you're referring to, a lot of times, it's some of our belief systems, some of our thinking patterns, some of our past experiences that's creating, this sense of, sadness that we might refer to as clinical depression. Not everybody, I mean, everybody gets sad. I'm not, referring to, just people who are sad, but more so on a clinical level where it's impacting functioning. It's impacting relationships. You're not able to, operate within your roles as a parent, as, at work. You're withdrawn socially. And so, we certainly encourage people to seek that support, so that we can walk with you along that way to learn better thinking patterns, cognitive behavioral approaches, DBT therapy is mindfulness approaches are a number of the more effective treatment approaches for those kind of disorders.
Okay.
We do have additional questions. For those who don't have the best insurance or any at all, how would you go about seeking help?
Yeah, and unfortunately, in America, that's still an issue, right? So when a person doesn't have insurance, there are ways within the county and within state government, Medicaid, county care. There's sliding scale fees that we offer. And so those are a number of ways that we can certainly try to steer people to.
I think that there's also, I want to say there's something online where I think they pay a fee, where it's like a telemedicine appointment. And telemedicine has become huge. Especially since COVID, where you don't physically have to come in. You can actually do it over a video conference or Zoom, or they have some type of link where you're actually looking at, you can see the therapist
Yeah.
on the screen.
Yeah.
And so there are some, I'm trying to think of what the name of there's a-
Better health.
yeah, there's one where they can
them.
actually go in and they can actually, it's a plan, and you actually can, I wanna purchase 3
Yep.
sessions, and so, we'll come up, I'll think of what the name of it is, and we can put it up, on our site, so you're able to access that. I still think, even, so if you can't come in, you can do telehealth. I think sometimes in person is, if you're able to do that, is much, it's a little bit more helpful, because then you have the human contact there. But the telehealth is going to be the next best thing. So we just want to make sure that you are able to connect with someone to kind of go through what you need.
Yeah, and telehealth really did help change the game. Now that therapy is more accepted, and now it's even more accessible.
Yes.
Which means you don't have to travel
Right.
An hour on public transportation to get there. That we can certainly log on and meet you right in the comfort of your own home.
There's another question. When counseling adolescents, how important or what role does the entire family play in therapy?
That's a good one.
That is a good one. So I have a pet peeve where parents might say, hey, this is what's going on with my son or my daughter, fix them. Right? And it's not that way, right? So it's a family system. And so I look at the whole family, and I evaluate parental approaches, parental family interaction. When we meet for the first time, it is our opportunity to really gather as much information about the issue that's being presented, and so I don't go on face value of it's the kid, fix them. It may be, but children are a part of yeah, absolutely. So there may be certain small tweaks or things that we can address within parenting approaches, but also really targeting and focusing on the identified client, which would be the teen or the adolescent. And we have conjoint sessions as well, maybe one-on-ones with the child, but we may have family sessions as well.
And I will say, and I'm not a psychologist, I'm not a psychiatrist, and none of that, but the social media aspect is a problem, and they grew up with it. We know of a different time, and so they're probably a little bit more isolated.
Yeah.
Because they're always on social media, and social media has, it's a perception. So people go on social media and they're the happiest, they're they're beautiful, although they're not saying that they're putting a filter on that picture. So it's unrealistic ideas, and I think our kids are having a hard time. And like I said, COVID didn't help it. It just made it much more apparent. So I think that I don't know what to do about it, because I think the cat's out of the bag. But it's maybe how we deal with the social media, because I don't know if that's going to ever go away.
No, it's here.
It's here.
It's
We're
here.
on it today.
Yeah, exactly.
But there are pluses with social media. There are negatives with, so just like anything else, it's just maybe monitoring that aspect of it too.
Yeah.
That's just my own opinion.
Yeah. No, those are very good points. And there's bullying that occurs within the adolescent and with children. And now they can reach you right into your home. There is no safe, space for children, because now they can reach you through the social media networks.
And before, when we were bullied, they moved on the next day.
Right.
But the social media, it just stays. And so it is, forever, which is why I always tell my kids, watch what you put on social media because it is there.
Yeah, yeah.
So
it lives forever.
it lives.
Yeah.
There's a twofold question. How do you know when to seek professional help when it comes to depression? And the second part of that is, what are some indicators?
All right, very good question. So some of the indicators for depression would be not feeling happy for most of the day, not being able to experience pleasure. You might be, sleeping more or having some level of a sleep disturbance, whether it's hard for you to get to sleep, stay asleep. You might sleep for 10, 12, 14 hours in your day. Your appetite might change a bit, so you're not eating as much. Your concentration, and ability to focus at work might be a bit off. There's, low self-worth, maybe some guilt that you might be feeling, some low self-esteem perhaps. These are some of the criteria that we look for when we're meeting with individuals, and you tend to only need to meet 5 of about 9 of those if I name them all. And that's when I said everybody gets sad, but you may not meet the criteria. If you are, experiencing a number of those issues and they are impacting your ability, to function in your day, then I would encourage you definitely to reach out and get some help. And then the second part.
The second part of that question was, let's see, what are some indicators? That was the second part.
First part.
Yes. The first part was, how do you know when to seek professional help when it comes to depression?
Yeah.
And what are some indicators?
Yeah, yeah.
And if you're unsure, seek help.
Yeah.
Because if you are concerned that that's what's going on with you, then that's probably what's going on with you.
Another question, do you believe Black children, especially Black young men, should see only Black therapists?
I personally believe that any provider who's trained and professional about the way they work certainly can treat any individual. It's a matter of preference and comfort that I think is important here. And when a young African American male, they may identify more with an African American male, but from a professional level, I think anybody can treat anyone. It's more of that personal comfort level and identification.
And I agree with that. Yeah.
Yeah.
I mean, I've seen women who, they're like, should I see a woman for a gynecologist or should I see a male? There are some fantastic male gynecologists and there are some awful female gynecologists. So it's just like your child's an individual or you're an individual, the treating practitioner is also going to be an individual. And it's more of a preference and who you connect with.
Yeah. And just to say a little bit more about that, we're underrepresented in this field. The representation is very low, and which is another reason why there's a big demand. And so I would encourage men, now that it's more acceptable, please come see me if you're looking for any kind of position to help support people in time of need, because it's needed. We need more representation.
Question, how do we set up an appointment?
Oh, yes, good question. So I can be found in a number of ways. First, you can simply call me. My number, I can be reached at 708-793-8332. And you can leave a detailed message there if I'm unable to answer. I can also be reached by email at kmcgee@stepstowellnessllc.com. And you can actually follow me, or not follow me, but find me on psychologytoday.com. You can enter my name when you click Find a Therapist, Kelly McGee.
can you ping the information here on IG? Yes, we will do that. Sorry. We will definitely do that.
And tell your friends to watch this episode if they didn't get a chance to view it, because mental health is important. It is going to affect every aspect of your life. And so we have to make sure we are taking care of our mental health. Just like we go, to get massages, we go to get, facials, we go to get workouts. So we got to work out the mental health aspect of it as well. It is a part of your total well-being.
Absolutely.
Yeah.
Absolutely.
Do we have any more questions?
No, thank you, or folks are saying thank you, and no more questions coming in.
Well, thank you, Kelly. That was
Yes.
fantastic. And Kelly is located at 7151 183rd Street at the Wellness Center. So we are looking forward to seeing you guys. We just want to make sure that you know what you can do, where you can go to help with your mental health.
There is one more question that came in.
Okay.
Have you ever thought about doing a small workshop for young African American men?
Yes, I would love to do that. In fact, I did do groups, not necessarily workshops. I did run some groups for adolescent, teens in troubled teens in the city. There was a small grant for an agency that I worked for, and that was like probably one of the most fulfilling part of the work that I do is really helping young African American men get on the right footing and deal with some of the trauma that they deal with, living in the city and living in this society. We gloss over those kind of things, but those are real things that happen, and it's trauma that they experience, and they're still expected to function and go to school. And so those workshops and those groups were very, very important. And so absolutely, that is a part of my growth plan for sure.
We've got lots of things in the work.
Yes.
They're coming.
Yes.
Thank you guys for joining us, and we will talk with you soon. Have a happy Thanksgiving.
Happy Thanksgiving.
It's coming.
Yes.
Don't eat too much.
Yes.
And we will see you next month for our Talk with Terry Tuesday. Thank you.